episode 81 of the Sean McGinnis podcast. Today, I'm delighted to be joined by Dr. Aamer Sandoo. Is that how you pronounce your name? Just to make sure.
Correct. Yes. Yeah.
Dr. Sandoo, Dr. Sandoo. Now, just for my own benefit and the listeners, how have you got into the kind of position you're in at the moment, or what drove you to it, or interest-wise and stuff? It was fascinating.
Yeah. Okay, well, welcome to all of your viewers, and it's great to be on this podcast as well. So I'm looking forward to talking through some of the themes that we're going to discuss today about exercise and health. And I've actually always been interested in using exercise as medicine, really. So, with exercise, we have this activity that we can actually do that can prevent so many chronic diseases. And then if you have certain diseases, it's one of the best ways to treat those diseases as well and improve kind of long-term outcomes, health outcomes, quality of life, life expectancy as well. So I've always been interested in exercise physiology, trying to understand how exercise can actually alter systems in our body to improve our health. And that's pretty much what I now lecture in Bangar University in the UK. And it's a passion of mine to teach students so that they can actually go on, become practitioners, work with people in the wider population, and really it's that whole concept of exercise as medicine, and that's what we want to try and encourage and really get out there.
Yeah, that's brilliant. And as I was saying off air, I actually came across a lot of your videos on YouTube, so I had to get you on because I think I'm a personal trainer, obviously working with people, and obviously weight loss, fat loss, general strength. But in my opinion, and you probably agree, a big portion which has left out, ironically, from the fitness and health. We obviously have weightlifting, which is brilliant for a certain aspect, but there's a lot of adaptations that we cannot get from weight training that we need cardiovascular training. So kind of an all-round plan that has to be in there, doesn't it?
Definitely, yeah. I think quite a lot of people make the mistake of just doing one type of training. So if they're doing, weightlifting, resistance training, they only do that type of training. And then you get some people that are, for example, doing aerobic training, and that's all they do. So there's no crossover. And what's interesting is for example, if you're a runner, there is scientific evidence to suggest that if you incorporate some weight training, it can actually help improve your running economy. It can improve the efficiency by which you make your movements as well. Obviously, a runner wouldn't want to bulk themselves up, but some resistance training is important. And likewise, if you're a weightlifter, then when you're lifting heavy loads, you want to make sure you're trying to get that oxygenated blood to the muscles as quickly as possible. So if you do aerobic training, you allow some of those adaptations to take place in the muscle. So for example, you get more blood vessels growing in the muscle itself, which will mean that when you're doing heavy lifting, you've got much more efficient blood flow going to those muscles. So in a way, it can help. And I think the best athletes are the ones that combine all these different training approaches, because you can't just do one thing and not do the other. They need to go hand in hand.
Yeah, 100%. And even from probably my own background, I played sports my whole life and have done both weight training and some kind of cardiovascular activity. But I think when I was starting off in the fitness industry, probably about 9 years ago, there was a big push for high intensity. So it was kind of a thing then that was like, oh, don't do any low aerobic moderate work. And then there'll be pictures of some marathon runner because you'll lose all your muscle. But obviously that's a skewed view. Then over the past few years, there's certain adaptations that you can only get from low moderate work done over time. And I've heard you talk about. So can you just touch on that? Obviously, the adaptations that you cannot get from the higher intensity work that we need, that low to moderate work.
Yeah, so the low to moderate work will there'll be a number of things that happen. The first thing is that obviously it gets your heart working hard over a longer period of time. So when you're doing low to moderate intensities, you often can increase the duration. So whereas if you do high intensity stuff, the duration is often quite short, but with low to moderate intensities, you can actually increase the duration. So your heart is actually working harder for a longer period of time. That can actually lead to what we call left ventricular hypertrophy. Now, I know that's a scientific term, but if I break it down quite simply, then essentially it means that the part of your heart that pumps blood to all of the body, that part, which is a muscle basically, it becomes stronger. And so it means that every time your heart beats, it beats with more force, so more blood can be circulated to the body. So it's increasing the efficiency by which the heart works. So that's one of the adaptations from low to moderate intensities. Then you have stuff that I talked about just a moment ago with the increased blood vessel formation in the tissues, but also in the heart muscle itself as well. And whenever you get growth of new blood vessels, we call this process, it's called angiogenesis. So this process occurs from kind of low to moderate long duration exercise. It can happen from high intensity stuff as well, but this increased angiogenesis or growth of new blood vessels basically means it's like a village getting loads of new roads, and so now everybody can access all of the different parts of that village. And it's the same with your muscles. Once they get those blood vessels growing in certain areas as a result of aerobic training, it means that the blood flow can go to all of the different parts of the muscle, and that will mean you get more efficient contraction. You'll have resistance to fatigue, so you can perform for longer. And then the other thing as well is that with low intensity and moderate intensity, you get metabolic adaptations as well. So we know that everything that we do in terms of exercise is dependent on our energy systems. So you will enhance the aerobic pathways. So you'll get more what we call mitochondria. They're like the little powerhouses in all of our cells that produce energy. And so mitochondria levels increased as well. And that's just some of the many adaptations that you get from aerobic training, low to moderate aerobic training.
Yeah, and obviously, it will be different depending on fitness level. But I put the definition just as a general statement is anywhere probably from 120 to 150 beats per minute. Would you agree with that? Obviously, everyone's a bit different.
Yeah, exactly. It varies from person to person, but that's about the right range. And one of the things that we say is if you've got clients and you've got people that are listening today that don't have heart rate monitors, then there is a very simple scale that you can download from the internet. It's called the Borg RPE scale. RPE stands for ratings of perceived exertion, and that scale has been linked to heart rates at different exercise intensities, and that scale can be used so you can actually do a training session, and if what you want to try and aim for is where it feels somewhat hard. So you don't want it to be really hard. That's when you're talking about the really high intensity stuff, but you want it to be somewhere from kind of like moderate to somewhat hard, and that correlates with these heart rate zones that you just mentioned there. So yeah, I think heart rate zones is great if you've got that information and you've got a heart rate monitor. You can use that to set your training zone, but if you don't, then the RPE, the ratings of perceived exertion, is a great free tool that you can actually use to gauge your perception of effort, and it's linked very closely to heart rate as well.
Yeah, brilliant. I've actually since getting into it, from the heart rate monitor, it's kind of like you're gamifying your training in a sense, especially when you understand all the adaptations. It's fascinating when you're putting yourself through the workouts, and over the week you can obviously see you're doing more with a lower heart rate, and I think just seeing that is brilliant motivation, and it's fascinating as well, the changes.
Yeah, exactly. And I think, yeah, for goal setting, I think using heart rate zones and having those as part of the goal set, like short-term goals that you might set for a client, that's extremely important. So I think, yeah, it is, and you can see that change occurring week by week as well. And the key thing is that as your body starts to adapt, you can start to, tweak which training zone you're going to be working in. You can probably go a little bit harder as the weeks progress as well. So that's the great thing about using, heart rate training zones as well. And it's all related to, what's happening physiologically, because, whenever you do aerobic exercise, it's very much a cardiovascular and cardiorespiratory process. So your heart and your lungs are doing quite a lot of work to try and make sure that your body stays, the environment within it is constant and stable, what we call homeostasis, just to try and keep the body stable. And your heart and your lungs, along with the brain, are working together to try and make sure that your body stays stable. And all of those adaptations that take place after you finish the training in the recovery period, they enable your next exercise bout to be more efficient. And so you just keep building that up with subsequent training sessions, and you start to get you start to get better in terms of your cardiorespiratory response to exercise as well.
Yeah, and even from training people, especially if you get someone relatively unfit or deconditioned, what they might have done in the past is go straight into training at really high intensity zones, and they don't have any of that recovery capabilities, and end up just ruining themselves for a few days. But it's fascinating just bringing them through low to moderate, but done often. And they can't believe, they're like, wow, I actually feel good after my sessions. This is brilliant. And
that's right.
They're not physiologically causing a large amount of stress for their condition.
No, and Sean, what I was going to mention there was, if you've got somebody who's unconditioned, so they're not very fit, they haven't exercised before, so they're sedentary, then doing intermittent exercise is extremely important. It's a good way to get them into exercise, because if you get, it is true that if you get somebody who's never exercised before and you say, right, I want you to do 20-30 minutes of cardio exercises, it's going to be impossible for them to maintain that. You've got to have a lot of internal motivation. But if you basically say to that person, right, what we're going to do is split it into, say, 3 10-minute blocks. So they're still going to do 30 minutes of exercise in that day, but it's split up into 10 minutes in the morning, 10 minutes at lunchtime, 10 minutes in the evening. And so that's a good way to try and increase the motivation. And then as they get fitter, you can then combine into longer continuous sessions as well. And there is one other point that I wanted to make, that this is related to everybody really. Sometimes and I am guilty of this myself, I go to the gym, I do my 1 hour session, and then basically I go home and I'm sitting down watching television, or I might have been sitting down in the office all day as well. And what research has shown is that the time that we spend sitting, if that's too long, then it doesn't matter if you go to the gym for 60 minutes, you're still going to get the negative benefits of sitting down for too long. So what we really want to try and encourage for ourselves and for everybody and more widely is to just constantly be active. If you think about your day and think about what you're doing in a given hour, then we can easily put in, say 10-15 minutes of a short walk, or some exercises that we could do at our desk, maybe walk to the shop to get our lunch, or stop, or park the car further away from wherever your place of work is, so that you do a little bit of walking. But the whole idea of spending too much time sitting, that's an emerging risk factor. And so we've got to try and do things where we're as physically active as much as possible, because that 1 hour session in the gym isn't always going to be enough to prevent all of the potential diseases that we could get as we get older.
Yeah, that's fascinating. And even obviously, if someone's pretty deconditioned, them doing 10 minutes of a brisk walk could get the heart rate in the zone. So even if they split that up, coming from a beginner, can they still get like the same structural changes start to happen as the same as one big session during the day?
Definitely. The great thing with exercise of any type is that you start to get the adaptations happening whatever you do. But if you go from being sedentary to doing just something, that's probably where you see the biggest changes. In fact, when you get really fit, the adaptations have already happened. It's very hard to get even bigger changes in terms of adaptations. But it's when you go from doing nothing to doing something, that's where you often get the biggest changes. So I think, keeping yourself physically active, because that's the other thing as well. We should count things like housework, gardening, shopping, all of the physical tasks that we're doing in a given day. They should be counted as well in our kind of exercise that we do. So exercise is a little bit more structured. It's generally defined as something that's structured and planned, whereas physical activities anything that kind of increases your energy expenditure. But we want to try and combine exercise sessions, but also think about how we can change our lifestyle so that we're doing more and more physical activity, like gardening, like household chores, and count all of that towards what's happening. And the body does adapt. The body does adapt, especially if you are sedentary. That's when you will get those biggest changes.
So if someone comes from a sedentary, how long will it take? Can they get those changes to like the left ventricle straight away, or what happens first? Is it more the oxygen uptake, or does the heart changes take longer?
Yeah, so I think when you have structural, so the left ventricle, the change to the heart, that would be a structural change that takes a little bit of time. So you'd have to keep at it. So that, I think those type of changes, we're talking about weeks to months. And same with the blood vessels, you will get some initial changes that happen straight away, but the kind of larger changes, if we look at it in terms of the changes that make the biggest difference, they take a little bit of time. And that's why for us, it's important to make sure that we keep the patients or the clients motivated, so that they can get to that stage where the structural changes can take place. So it does take a little bit of time, because you need to do the sessions, recover. That's when you get some adaptations taking place. You do another session, you get further adaptations, and so it's it's like a cumulative effect that builds up over a period of time. And we're talking, probably weeks to months to get those structural changes. But there are some initial changes that might happen. For example, is when you do an exercise session, we'll get increased blood flow going within our blood vessels, and that can increase something called nitric oxide, which is a molecule or a gas released by our blood vessels to cause them to dilate, but it also prevents the arteries from clogging up. And one of the good things about aerobic exercise in particular is that the blood flowing through the vessel as we exercise, the increased blood flow increases nitric oxide release, and that then protects our blood vessels from developing atherosclerosis or narrowing or clogging up of the arteries. And those changes can be quite soon. So we've seen in research studies that if you do an acute bout of exercise, so you go to the gym, you do a 60-minute aerobic session or 30-minute aerobic session, and we can see improvements in blood vessel responses almost immediately. So that there are changes that are happening in the body physiologically that are beneficial straight away.
Wow, that's fascinating. Yeah, it really is. So if someone says maybe the starting blocks are like atherosclerosis or like plaques or whatever, so even just one session, you're starting to increase blood flow in a sense reverse that a little bit.
That's right. So one session will be beneficial.
Wow.
And the other good thing as well is that we haven't talked about glucose, we haven't talked about insulin and how that's regulated and changed with exercise as well, and also fat metabolism as well. So the good thing with exercise is that you do get increased what we call sensitivity to insulin. So whenever we eat a meal, we have an increase in the hormone insulin, which gets rid of the glucose circulating in our blood, which is broken down from the food that we eat. We basically don't want to have too much glucose circulating in the blood because that can cause damage to the blood vessel. So insulin is released and it makes the glucose be stored in the muscle and the liver. But what happens in some individuals, particularly those that are sedentary, is that they get insulin resistance, which means that when insulin is released, the body doesn't respond to it, and so the glucose remains high in the blood and it starts attacking the blood vessels. Now with exercise you can get quite a marked increase in sensitivity to insulin. So when insulin is released, the body responds to it much more readily and that glucose is taken away. Some of that glucose is also burned up in the activity itself as well. So you do get these metabolic changes that are happening that are relatively immediate following an exercise session.
Yeah, it's fascinating. And just like you said at the start, having certain metrics with clients to be able to look at as your form, especially because, okay, yes, people want to lose weight, but say I get with a client, okay, let's get your resting heart rate starting off. Let's get your blood pressure. And obviously, as someone gets aerobically fitter, naturally those things are going to improve anyway, right?
Yeah, that's right, exactly. So again, the research tells us that those people that have higher cardiorespiratory fitness, they have lower cardiovascular disease risk factors, and that includes, like you said, blood pressure, high cholesterol, type 2 diabetes that can be controlled better. Obviously, like, your waist circumference, having a lot of fat around your abdomen, which is linked to greater risk of death in certain individuals. All of those changes can happen with aerobic exercise. So again, the fitter you are, the lower your risk of having a heart attack or stroke. And that's the key thing, really. Aerobic fitness is so strongly related to having heart attacks and strokes. And those people that often have the poorest fitness, the lowest fitness relative to people of a similar age and gender, they often have the highest risk of having a heart attack or stroke.
Yeah, because I knew obviously as your left ventricle hypertrophies increases, obviously that's going to stroke volume is going to increase, and that would kind of be a mechanism to lower your blood pressure. But obviously that in combined with the nitric oxide, that's fascinating. So they're both working together to that blood flow and the dilation of your arteries.
That's right, exactly. So all of these, what we call in physiology is like integrative physiology. So
Yeah.
there's a number of things that are happening at the same time, and they're probably too numerous to talk about. If we were to talk about all of them, it would get very complicated. There's so many processes that are occurring at the same time in terms of what's happening during exercise, but also in the recovery period in terms of adaptations. So the key thing is just an individual will be able to see for themselves, once they take part in physical activity and exercise, they will start to notice several changes happening in their body, and those will be, for example, a reduced blood pressure, a lower resting heart rate, reductions in weight. If we were measuring their blood glucose, blood cholesterol, after a period of time, we'd see those reducing as well. So all of these changes, are happening at the same time simultaneously.
And just out of interest, if someone was really, really unfit and potentially overweight, if they were worried about their cardiovascular health before starting, would it be worth them even going into someone like yourself or a cardiologist to maybe have a look at a stress test or even plaque buildup in the arteries? Is that wise for some people?
I think it depends. Now, if you've got somebody that's having symptoms, so
Yeah.
they're getting chest pain, especially when they have exertion. So if they have chest pain during exercise or any type of exertion, it might be that they have angina, and they might be in the early stages of developing cardiovascular disease.
Yeah.
So in that instance, it is better that they do go to their physician, they get a referral to a cardiologist, and they can be thoroughly examined. In those people that are like asymptomatic, so they don't actually have any symptoms, but they might have some of the risk factors, then I think if it's a good idea that if you do have access to a facility that might do some medical screening, so it might be a scan of your carotid arteries, for example, to see if there's any plaque buildup. There might be some blood tests that can look at whether you do have high cholesterol, or whether you do have insulin resistance, for example. It's worth having those done, and that would then give you a good baseline. So you would kind of know where you are in terms of your current health parameters. You'd then, work with somebody like yourself, and undergo a period of exercise training from somebody that understands how to prescribe exercise to, a person who's at risk of cardiovascular disease. So you go through that training process, and then you can be screened again to see the changes in those parameters. And I think that in itself is a big motivation, because you're really working to change some of those risk factors, to reduce some of those risk factors. So I think it would definitely be a good idea. But if you're a young person who's sedentary and doesn't have any risk factors, I would say you probably don't need to worry about screening. You just need to get out there and do it. Yeah. You need to find a way to motivate yourself to actually get out there and start doing some form of exercise. Maybe take part in a sport that you've never done before. Try something new. So there's so many ways that you can actually get into it. And once you do, most people find that they never look back.
Yep. Oh, that's brilliant advice. And last thing on the adaptation to low to moderate, because again, I find it fascinating. As you said, you could probably talk for a few years on this, is the mitochondrial density. So the increase in mitochondria, because they're the powerhouses of the cell. They increase, they give us energy, they break down fat, carbohydrates, and from a fat loss perspective, like, you need well functioning and lots of mitochondria. And from an energy perspective, right? And these things
Yes.
drop off. They drop off as we get older, right?
Yeah, you will get some, especially if you don't exercise, you'll get a reduction in mitochondria, and that might explain why, you know, we're not as fit as we are when we're in our 20s or 30s. As we start to get older, we start to, you know, have aging within our physiological systems in the body as well. But definitely the mitochondria are extremely important because they produce what we call ATP, or adenosine triphosphate. That's the usable form of energy in our body. So all the food that we eat essentially gets converted into ATP, and then when that's broken down, that releases energy into the cell, and that cell can carry out its function. So the more mitochondria we have, the more ATP that can be produced, and so the cell will have greater amounts of energy. And with the low intensity exercise as well, fat is you know, one of the most calorie dense foods that we can eat. So there's so much energy in fat relative to, say, carbohydrates or protein. So that's why when we do low intensity, long duration exercise, so if we're thinking about, you know, big endurance events like cycling or running, then we'll be predominantly using fat as a source of energy. And as the intensity starts to increase, so as the exercise gets harder, we start to shift our fuel use, and it transitions from primarily being fat to a mixture of fat and carbohydrates, to then only being carbohydrates that are supplying the energy when it's very intense exercise. So if you wanted to lose weight, it's better off doing long duration, low intensity exercise, so that you're tapping into some of those fat stores, so that they can provide that energy over that longer duration. And then you will find that you'll start to reduce your weight as well, but also more crucially, your body fat percentage, and the fat that might be around your abdomen.
Yeah, that's 100%. And again, what I normally tell people, and comes back to before I kind of understood energy systems. So I'd get a new client in, I'd say the first session I would finish off. Maybe we had a sled track in our gym, so I'd make them sprint up and back, one rest and go again. Now, obviously, because they had no aerobic base and they couldn't process all this lactic acid and break it down properly, they do about 3, take a minute, and then they look like they've been hit by a bus. They just go pure white, just because they don't have that capabilities to break all the systems down. So after a few weeks or a few months, whatever, of so low to moderate, especially from a beginner level, then we can look at adding in this higher intensity stuff. Now, what are some of the different adaptations that we get from the more interval training, or when we're in the higher intensity heart rate zones?
Okay, so when you're in the high intensity heart rate zones, you get better clearance of lactate. So when you're doing high intensity work, you tend to produce more lactate and actually specifically hydrogen. And it's the hydrogen that causes fatigue within the muscles. So it's quite a complex series of biochemical reactions that take place. It's all about trying to produce energy, but sometimes you don't have as much oxygen being delivered to the tissue when you're doing high intensity work. There's just not enough time for the oxygen to get to the tissue. So it works what we call anaerobically. And so you tend to get a large production of lactate and hydrogen. And so that builds up and causes fatigue. Now, one of the things that happens with high intensity stuff is that we have an increased ability to be able to remove that hydrogen and almost neutralize it, because hydrogen makes the blood very acidic. And when the blood becomes acidic, it stops key enzymes from working properly, and that then contributes to fatigue. So the high intensity stuff allows better clearance of lactate. So some of it gets shuttled away from the working muscle to muscles that are not working. So we get some increased lactate shuttling. We get something called bicarbonate buffering. So bicarbonate is something that's produced within our body, and it helps to transport the carbon dioxide that's produced when we do exercise, especially when it's high intensity exercise, and it helps to kind of transport it to the lungs to be breathed out, and it also helps to neutralize the hydrogen ions as well to prevent that acidity. So those are some of the adaptations that take place, and when those adaptations happen, they allow us to work at what we call the lactate or anaerobic threshold, which is the point at which you cross over from working aerobically to then working anaerobically, and when you start to have a greater risk of fatigue. So what we want to try and do is to increase endurance performance, we want to increase the lactate threshold. So we want all of these mechanisms with the bicarbonate buffering, neutralizing of the hydrogen ions, the shuttling of the lactate. We want all of those things to be efficient, so our threshold to the point when we start to fatigue can be increased. And that's one of the good things that high intensity or interval type work does. It helps to increase your lactate threshold. And in fact, again, research has shown that that's more important than your absolute cardiorespiratory fitness. So it's more important to be able to work for a long period of time at or just under your lactate threshold, as opposed to just having lots of aerobic fitness, but then you actually fatigue quite quickly when the intensity gets quite high.
Yeah, wow, that's fascinating. So normally, again, the recommendation I'll give for a general is kind of like 80-20, so 80% maybe in the moderate range, and then 20% obviously depending on someone's recovery capabilities in a higher intensity zone. So I don't know if, what about yourself?
Yeah, so I think that kind of stuff is fine, and manipulating the work to rest ratio is another way that you can actually do it as well. So, there's various different ways that you can try and get an increase in the lactate or anaerobic threshold, and it will probably vary from person to person. It will also vary from depending on the sport, the demands of the sport as well. So you probably have to set that work to rest ratio quite specific sometimes to a specific sport, so that you can mimic what might be happening in a real setting. But yeah, there's lots of variations, but I think 80 to 90% of that intensity is going to be sufficient to get those adaptations that are taking place. And again, you can just manipulate the rest periods to make it longer or shorter, and just depending on what you're trying to achieve.
And from a perspective of adaptations in the heart, is there a difference from the low to moderate?
Yes, there will be. I think the heart is going to be, you'll still get, if you didn't do any low to moderate stuff and you jump straight into interval training because you have a good level of fitness already, then you will still get further adaptations happening in the heart in terms of the hypertrophy of the left ventricle, better filling of the heart as well when it's relaxing, so you get better filling of the chambers as well. You might get enhanced electrical activity of the heart as well. So obviously the heart contracts because the sinoatrial node sends electrical signals to the muscles. So you might get better signaling of the electrical signaling as well, enhanced electrical signaling as well. And of course you will get growth of new blood vessels on the heart wall itself, which enables the heart to be better perfused as well of oxygenated blood, so it doesn't get fatigued as quickly. So I think there are still adaptations that almost build on the stuff that you would get from low to moderate stuff. But I think low to moderate aerobic exercise is probably the most effective in terms of the adaptations that you see in the heart muscle. But you will still get some additional things happening with high intensity interval training. But I think with interval training, the great thing that it affects is the energy systems and the metabolic changes and the resistance to fatigue. Those are the key things that it enhances.
Yeah, that's fascinating. It's amazing when you obviously combine them both nicely. As you said, you'll in between your intervals, not only is your ability to buffer lactate and all that stuff come down, but then your aerobic fitness will bring your heart rate down and you buffer lactate quicker so you can go again. So it's fascinating even looking at, if it's from a heart rate perspective, how quick it comes down and those adaptations
Exactly.
when you can see it visually.
That's right. I mean, the great athletes are ones that can recover very quickly. And I mean, I always think about boxing as a sport because it's really, really tough. And it combines aerobic elements, but also it combines that high intensity stuff. So if you think about what a boxer might do in one round, they need to have that aerobic fitness to be able to last the whole round or even last 12 rounds. But they also need to be able to have the ability to perform anaerobically at a high intensity for some periods of a given round or some periods during a particular bout as well. And then they've got to make sure that their training is such that when they go into their corner for their 1 minute recovery, they are sufficiently recovered for the next round. Now, if they don't train, then they get to the corner after the first or the second round, they're going to be absolutely exhausted. The physiological processes won't allow them to, replenish the energy stores or get enough oxygen to the tissues. They'll start to feel fatigued, and then, they'll basically have a decrease in their performance. So the idea of doing, and boxing is an interesting sport because they do all types of training. They'll do the aerobic training, they'll do the high intensity stuff at different stages. They'll put in a little bit of resistance training as well. They need to have very good flexibility. And then, you throw in the other things like really good muscle coordination and that neuromuscular coordination and all of those things. And you get pretty much what I would say a complete athlete.
Yeah, I've just recently, after playing sports my whole life, took up last 3 years Brazilian Jiu-Jitsu, which is,
Wow.
again,
Yeah.
it's a combination, I've heard you talk about, of all these different things, because then you have isometric work, which then works the heart differently again. So would that be similar to, so when the heart wall, and you can obviously explain this, concentric hypertrophy of the left ventricle, isn't it? Would that be similar to weight training? Would you get different adaptations from weight training and from the high blood pressure and kind of stuff like that?
Yeah, so the resistance training will affect the heart slightly differently. Obviously, the heart still has to work quite hard when you do resistance training to try and and your blood pressure increases as well. So your heart has to work even harder to get blood to the muscles. There are I would probably say that the adaptations are still going to be similar, but of a smaller magnitude or smaller size to what you get with aerobic training. The aerobic training is going to be a much more direct effect on the heart, but resistance training is probably not going to have as direct effect on the heart. It will have a much smaller effect. It will still affect the heart. You will still get some adaptations taking place, but they will just be smaller in magnitude.
Yeah. And I think I've heard you say, obviously, when we do like low to moderate work, we want low blood pressure. You want those arteries and veins relatively relaxed, right, to get blood back and forward to the heart. But when we're weight training, we're obviously like tensing up, and then our blood pressure goes up, so it won't go smooth, right, to the blood flow back and away to the heart.
Yeah, so that's it. So one of the things that happens with weightlifting is that we often do the Valsalva maneuver, and that when we're lifting, we're actually holding our breath, essentially, to put it in simple terms. That can actually be good for the movement because it stabilizes your body, and if you're doing things like the squat, for example, actually stabilize, holding your breath whilst you're at some portion of the movement can reduce the load that's going on the spine as well, the compressive forces. So by doing that, we increase our blood pressure quite markedly. So if we were measuring blood pressure when somebody was doing like a squat or a deadlift or something, we'd see very high blood pressures. But it's very short acting because as soon as the movement is finished, the blood pressure will come quite quickly down. But it's sometimes why we feel a little bit dizzy as well, because when we do weightlifting movements and we have that increase in blood pressure, then the body tries to compensate by dilating some of our vessels to reduce the blood pressure. And so that's why when you perform the lift and you're in that rest period, you start to sometimes feel a little bit lightheaded and maybe a bit dizzy, especially when you've lifted very heavy weights. And that's again the physiological response that's happening to that increase of blood pressure. But the good thing is that, when you do have that increase in blood pressure, that is still a load, that's still the blood actually exerting a load on the blood vessel wall. And again, studies have shown that resistance training can also increase nitric oxide levels and improve blood vessel function and ultimately heart health as well. But it's just a slightly smaller magnitude or size compared to aerobic training, but it still does, resistance training still has a beneficial effect on the heart. So, anybody that has a misconception that, you only have to do aerobic training to get the heart benefits, well, that's not true. Resistance training can still have beneficial effects on the heart, but to get the most benefits, you have to do aerobic training as well.
Yeah, fascinating. I think that's especially for people that are a bit time poor, when you're trying to combine everything into 2 or 3 workouts a week. That's when we may use a bit of both. Okay, just do like 20 minutes weights at the start, then we can do 20 minutes cardio, and then as someone enjoys a bit more, we can split it up. But yeah, it's probably no point stressing about the nuances straight away. Just get in there and just start moving.
Get in there. And I think one thing with training is you want to try and think of yourself as being an all-round athletic person. So you've got the capability to do a 5-kilometer run if you need to, but you've also got the capability to to go and do a nice squat. Be able to lift fair amount of weights with the squats or with resistance training. You want to be able to make sure that you've got good jump height. So, you do some plyometric training as well. Just being an all-rounder so that you can, because, we know that in life, you have so many different challenges physically that happen to the body. And you want to make sure that your training can reflect some of the physical challenges that you have in your life as well. So you just want to be a good all-rounder. You want to be able to lift heavy things, lift your shopping, or be able to do some heavy like manual work that you might do in and around the house or in your job. But you also want to be able to go for long walks or hike up a mountain. So it's just having that all-round ability to be able to do everything.
Yeah, I can't remember who was saying, I think evolutionary biologist or someone, where they're talking about both energy systems. Were like, yeah, you need to be aerobically fit, well, back in the day anyway, to move around a lot and potentially run and jog. Well, for those like life-threatening situations, you need your aerobic system on, and you need that strength and power. So they complement each other nicely.
That's right. And the problem is, in what's happening in the West in particular, is that we've engineered our cities to be convenient and just very opposite to being physically active. So you walk into a building and you'll see the lift will be right there in front of you, but the staircases you often have to find. You're like, where's the staircase? And it's often some obscure door that you've got to go through, but the lifts are right there. Every shopping center or place has got escalators. People will park right where their workplace is. The bus might drop them off right by their workplace. We've now got, especially in this era with social media and stuff, people are glued to their phones, to televisions at home. We've got so much information that just means that we spend so much time sitting down. Most of the jobs, particularly again in the Western world, is they're sedentary jobs. They're kind of office-based, desk-based jobs. And all of that contributes to increasing the risk of chronic diseases. And it's all, our cities have kind of been designed to kind of favor convenience rather than physical activity. And that process has happened over, quite a few decades. But we've now come to the realization that there's now a population of people that are ticking time bombs. They've got obesity, high blood pressure. They're basically waiting to have a heart attack or stroke. So what we've got to try and do is reverse, this kind of trend that's happened, to try and get people to be more physically active. And it's very difficult. It's not easy. So, you will know yourself, I suppose you get very motivated clients that come to you, but to try and get the people that aren't motivated to do something, that is the biggest challenge that we've got, in terms of trying to promote healthy behaviors and try to promote exercise. That's the biggest challenge. And it's not an easy one to address when you've got all of these societal things that stop you from being active.
Yeah. Well, I think, again, that's even the bigger issue, that probably governments and that, because humans in general, pretty we like to conserve energy, right? So we only move if we have to. But then I think who I was talking to a client yesterday who actually lived in Holland, and the studies in Holland where they architect the city for you to naturally move more without willpower. So you have to
Yeah,
cycle around. The obesity levels are hardly any because you're just moving naturally. You don't even think about it.
that's right. I mean, Holland is a really good example of a country that's kind of nailed it in a way. I mean,
Yeah.
cycling is. I'm in the UK. I presume you're Irish
I'm in
background.
Sydney, but yeah, I'm in Sydney at the moment. I'm in Australia, Sydney, Australia, but I'm from
Oh, okay,
Dublin.
yeah.
From Dublin originally. Yeah.
Yeah, okay, so you kind of know like the UK system. If
Yeah.
you're cycling, and I don't know how it's like in New Zealand, but if you're cycling, then you've got some driver that's right on you, and
No,
it's
it's a
it just
death
becomes
wish.
a
Yeah.
very dangerous. It's a death wish, isn't it? It's not something that we try to do it, but our roads and our walkways are just not designed for cycling. But Holland is a place that's really got that right, and so people do end up cycling everywhere, and they're encouraged to do it. They feel safe. They've got the infrastructure there, and we see the benefit on health. You know, we do see that benefit on health. So I think, yeah, there are some things that are way above us in terms of, you know, this is about policy making and you know, setting things for the future. But I think we've still got to try and lobby for that, and we've got to try and raise the awareness that, you know, exercise is that one pill that you can take that will, you know, be the cure for pretty much most of the chronic diseases. I mean, in the years that I've been reading about exercise, I'm often surprised by the different conditions that it can be beneficial for. So, for example, if you've got cancer, exercise can benefit you regardless of what stage your cancer is at.
Well,
Exercise is shown to improve long-term outcomes for those patients and their quality of life. It's even there's neurological conditions like Parkinson's disease, Alzheimer's disease, where exercise has been shown to actually you know, improve neuron health and you know, increase factors in the brain that encourage neuron growth, and again improve long-term outcomes for those patients as well. So I'm often surprised. Sometimes we think of exercise as like a cardiovascular type you know, treatment, but actually it's a treatment and cure for a number of different chronic diseases.
it's fascinating. Even my girlfriend, her grandma actually lives in Poland, and I think supposedly she got diagnosed with Alzheimer's about 8, 9 years ago, but she still does 10,000 steps a day, and I think there's research again, even when you're in like a relatively big calorie deficit, delays all that. But she's absolutely fine 8 years later, so there's definitely something going on.
Yeah,
She shouldn't be
yeah,
living
no,
this long by the sounds of it. Like,
yeah. No, I think exercise really is, you know, we're only beginning to really understand all of the effects that exercise has on different organs of the body. But as soon, whenever new research comes out, it's always in a positive light. You know, if you're doing moderate intensity exercise, you know, it's all about trying to keep things in moderation. Nobody's saying you have to do extreme exercise to get these benefits. You only have to do moderate, low intensity even is better than nothing, but moderate intensity, and you will start to get these benefits on all of the organ systems in the body. And you know, the biggest problem that we're having, again, is worth talking about, is depression, anxiety, stress, especially after the last 2 years where people have, you know, endured lockdowns in various parts of the world. And one of the things that has kept a lot of people going is exercise. And we do know now that there's several studies that have shown exercise has been linked to reduced rates of depression, and is actually a very good form of treatment for depression as well. So particularly before you get to stage where you need medication, exercise is something that should be tried first. So again, it's a very holistic intervention that you can do. And I think once people realize that and they start seeing the benefits, that's what I was saying earlier, they never look back.
it is fascinating. My original degree is in psychology, but obviously that was like, okay, purely from a therapeutical point of view. But then I got into all this health and fitness, and I said, well, the new thing around now is kind of like functional psychiatry or functional psychology. So let's look at your physical health. Let's combine it with the therapeutic approach. Perfect. That's then we're going to get proper results.
Yeah.
But one thing you did touch on, which is one of the main questions I want to ask, is around stress. Now, obviously, I'm in the process of doing some stuff with corporate wellness because, as you said, I think they've seen mental health days have doubled since the pandemic, and it's not as if today's world where you go, okay, just stress less. What's fascinating, and I'm sure you can expand with aerobic fitness, is you're actually improving your resilience, right? And you're improving your body's ability to deal with stress, which is probably just as important or more important in today's world.
Definitely, I think yeah, that's right. I mean, you in terms of when you do exercise, yeah, you are making your body stronger. So there is this element of it, but also mentally, it takes quite a lot for somebody to make that decision and set aside time to exercise and push through. What they might have several barriers that prevent them from exercising, but pushing through that, coming through to the other side, that enables that person to really have a good sense of achievement. And then, of course, you have various things released in the brain. So, we've always talked about endorphins and having this feel-good effect after exercise. And there's some research about endocannabinoids as well. Hopefully, I pronounced that correctly. Coming out that might be encouraging in terms of the long-term benefits of exercise. So it's almost like what we call the high after exercise, and there is a physiological reason for that. We are having release of various hormones following a bout of exercise, and they contribute to improved mood. They improve our sleep. So if you get better sleep, that in itself is going to reduce your risk of having anxiety and depression as well. We tend to eat better as well when we exercise. So there's so many knock-on direct and indirect consequences. And it is, we have to look at it from a mental health perspective as well as the physical as well.
Yeah. Yeah, I always joke, like, I've never tried cannabis, but after a big run, I'm like, this has to be the closest thing where you kind of don't, like, it's kind of like, oh, fuck it. Like, whatever's worrying you on your head, you're just like, I don't care at all. Like, it's such a strange state. Like,
it is, yeah. I mean, I'm not an expert in the kind of psychological aspect of exercise, but just as you've described there, when you're actually doing an exercise, you even feel, that arousal that you've got, that kind of high alert that you're on. All of your fears and stuff they just disappear. Whereas when you're walking about in your normal life, you might have your 100 things that you're worried about. You're feeling self-conscious and all of those things that are happening. But when you're exercising and the period, immediately after, those things don't matter. And there's going to be a physiological or some type of explanation for that in terms of what's happening in terms of the changes in the body. There's definitely going to be an explanation for that, but certainly we do know that exercise elicits those effects, and it's for anybody that hasn't done it, for any of the listeners today that the last time they exercised was many moons ago, just go out for a walk. Like, after they've heard this podcast, I would say go out for a 20-25 minute walk round the block. You'll see different things and you'll feel different things, and see if what me and Sean are saying is actually true. So the viewers can actually see for themselves today. Do one bout of exercise and see for yourself the changes that you'll notice within yourself.
Yeah, it's mad. I think where people get maybe a bad experience, like we talked about, is if they go straight from the couch into, say, like a mad high intensity class, suddenly they're training at too high an intensity for their fitness, and then they just feel sick after, just because they've just trained way too hard for their ability.
Exactly. You've got to ease yourself into it, and I think the older you are, the more careful you've got to be with that. But even when you're young as well, so whatever training you do, you will you will get DOMS, delayed onset muscle soreness, particularly if you do resistance training. And some people can be put off by that pain as well. They're like, oh, I went to exercise class yesterday, I'm feeling really stiff and painful today. The exercise must have aggravated something, but actually the pain is just the inflammatory process and that healing process, the adaptations taking place. So I think you don't want to be put off by that, and you want to make sure that you start gradually so that you can complete the session in an enjoyable way, and also any pain that you have in the recovery period isn't as severe. And so as you go through and you gradually increase your fitness, all of those things just become easier to deal with. And I think it's true. Lots of people jump straight into something because they want to do it flat out. They want to give it their best effort. But I think exercise, especially when you're sedentary, it's all about being smart and using strategy to try and think about the long picture. And that's what you're trying to do. It's the long game that you're playing. You're not thinking about the short term. You're thinking about the long term, and gradually getting to that stage where you can be quite fit and do a very hard session.
Yeah, so true. And Dr. Sandoo, my last question now, as we just touched on stress, I've heard you talk about how obviously the heart is linked to our autonomic nervous system, and you're talking about the cardiomyocytes. But how is it then as we get fitter? How is it, say we're in a stressful situation at work, is it true then like we can actually bring down all those noradrenaline, adrenaline quicker as we get fitter? How's our body's kind of capabilities to deal with stress the more aerobically fit we are?
Yeah, I think that, yeah, if you're aerobically fit, I mean, I don't want to say something that's inaccurate, so I'm just trying to think a little bit more about this question, because in terms of if you're a fit person, because fit people still get angry and fit people still get stressed, and they probably still have, and that stress can probably override some of the beneficial changes that happen in the heart. So, if you've got somebody that is quite fit, but they've got a stressful, they've either had a bereavement or they've got issues at work or some other issues, they might still be stressed, and that stress might be enough to still cause, adverse changes in the body. I think it's a tricky one for me to answer, because I don't necessarily think fitter people will be able to handle the stress that they might get off life better.
Would it be more accurate to say that the more aerobically fit we are, the better our ability to kind of get back into that parasympathetic state? So potentially then after we could reduce the heart rate down or jump back into that rest and recovery zone quicker,
Yeah,
we have a better efficiency.
yeah, because one of the good adaptations with aerobic exercise is that we get a lower resting heart rate over a period of time. So if you've done say 6 months of aerobic exercise training, then your heart rate might be a little bit, your resting heart rate might be lower, because your left ventricle becomes so efficient at pumping blood with each beat that it doesn't need to pump as many times. And people that have high resting heart rates, the reason why it's high is because to maintain all of the blood flow to all of the tissues in the body, the heart, because it's not efficient with each beat, it needs to pump much more frequently. So it's literally going like this all the time to try and get that blood to to the tissues of the body. But in a person who's fit, one contraction is strong enough to get lots of blood flow to the tissue. So you don't need lots of contraction. So your heart rate is lower. And I think in somebody who's aerobically fit, yeah, they might be generally calmer, their resting heart rate will be lower. They might, if there is a stressful situation, they might recover quickly from that stressful situation. So I think that could be part of the reason why aerobic training might lead to a better response to stress. But I think if there is still a life event that comes and you're supremely fit, you may still suffer from the effects of stress. And then it's almost like you've got to think about mental strategies to try and overcome that stress and move beyond it.
Yeah, as you said, it's such a holistic thing where we need mental coping strategies, physical, nutrition, sleep, recovery, all that lifestyle kind of stuff. Yeah.
Yeah,
Um,
yeah.
And last question off topic: when you learned about the heart, do you not freak out about all the things that can go wrong? Because I heard that's like a joke when you kind of, even when I was just learning briefly about it, I said, how many things can go wrong with this thing? Like,
Yeah, exactly. Yeah, it's very complicated. There are so many things that when you think about just the heart itself, essentially it's a pump. So it's pumping blood to the lungs, and then it's pumping blood to the rest of the body. It's doing that at the same time, and it's just beating from the day that even before you're born, whilst you're in your mother's womb, to the the day that you're actually, to the day that you die. So it's working continuously for that period of time. It's got electrical activity, that if that electrical activity goes wrong, then you might have the atria or the ventricles not contracting properly, which will then cause either a backup of blood or not enough blood going to the tissues, and then you have consequences from there. There's potentially problems with valves prolapsing or closing in or leaking. You might have problems with the coronary vessels that narrow and then start to cause pain in the heart. So yeah, there is so many things that can go wrong, but I think that's where the beauty with exercise is that, in people that are healthy, they don't have any underlying health conditions. The exercise is going to make sure that the likelihood of those adverse things happening in the heart is quite markedly reduced.
Yeah, I definitely have some clients that are probably on the border of like health, hypochondriac anxiety. So they need to see all the stuff. It's actually helpful to see all the stuff to show them that can go wrong if they don't sort their shit out, and also the stuff
Exactly.
that can go right as well. So no, it's
Right. Yeah.
fascinating. Dr. Sandoo, appreciate it. And obviously that's just tip of the iceberg in regards to this man's knowledge. So I know you obviously have a full-time job anyway, but your YouTube channel is brilliant. Where can everyone find your content on that?
Yeah, so if you type physiology made easy with Dr. Aamer Sandoo, it should hopefully come up on the YouTube search. And yeah, I've got lots of videos about different topics, clinical exercise physiology. So I talk about some of these chronic health conditions, some more physiological content, which is especially relevant to people that are studying either doing sport and exercise science, or they're working as a personal trainer and they want to understand about the physiology of the body, or to anybody in the kind of health profession. And then I've got some videos about obesity and some videos about what happens to the muscle when we do resistance training in terms of how it grows and becomes stronger. And what I try to do is to explain it in a way that everybody can understand it. So although some of the videos are physiological, I try to make sure that it's understandable to everybody, to specialists and non-specialists. I don't know if I always kind of hit that brief, but that's what I try to do. So yeah, it'd be great if people could check out the channel and subscribe and like some of the videos as well, if they do enjoy what they see.
No, it's brilliant. You'll be on the podcast bandwagon next.
Sorry, what was that, Sean?
I said you'll have to convert them to get on the podcast as well, because it's another brilliant platform. A lot of the specialists are on now.
Yeah, that's what I'm trying to. Yeah, it's just trying to find a time.
I
That's
know.
something that I know people just download the videos as an audio file and they just listen to it, as they're going about day-to-day stuff. But I think I'm going to explore the podcasting stuff next. It's such a, I mean, this is such a great area because it's just increased the accessibility to this type of content. I think about 10, 15 years ago, it was very hard to find this type of content and these type of discussions, unless you watched the program on the television. And again, there wasn't that much about this. It wasn't the dialogue that happens now with podcasts and YouTube videos. And I think it's a great direction that we're moving in terms of raising awareness of, the health benefits of various different interventions, but especially exercise.
No, I know, and especially with guys like yourself, some brilliant got professors from Stanford. They're all embracing it. Dr. Heberman's got all these brilliant guys talking about, and which is great to actually get the right information from the source. So that's what everyone needs.
Exactly. And I think academia in general has been quite closed for the last, well, in its history. So traditionally, it's kind of like, you've got to go to university to access this information. And that's when it came into my mind, well, really, knowledge should be available to everybody. And whilst obviously you've got students that go to university, they're paying their tuition fees, and they should get exclusive content. And it's not like the whole course that we do is on YouTube, but elements of it, which can be, beneficial to other people, are out there as well. And it's about just raising awareness about these things that are happening in the body and in response to different health conditions. And so that's what kind of made me want to go into it. It was more about not just walking into a lecture theatre and delivering a lecture and that's it. It's about doing a little bit more and giving something to the wider community, to those people that don't necessarily have access to a university facility, or they're not on a university degree, but they still want to learn this information because it protects them from the misinformation. And so that was like a driving factor. And once you do it, you start enjoying it, and you think, well, hang on, there's got to be more to life than just doing your job and teaching the students that come to university. There's got to be something more. If you're blessed with knowledge, and when I say I'm blessed, I'm standing on the shoulder of giants. So I only know what I know because of all of the people before me. But if I can share some of that knowledge, people can utilize some of the things that I'm saying and you're saying, and develop their knowledge, and that's how we continue to keep progressing as a society. So that's like it's a goal really to do that. And that's what kind of keeps me going, and I'm sure it probably keeps you going as well with the podcasts.
That's brilliant. And even some of the corporate clients that I get these days, executive, they know that stuff. Like, they're so endorsed with all the information research. Like, you better know what you're talking about because these people do for sure.
Yeah, exactly. Yeah.
No, that's brilliant. No, all your information is brilliant, and go over and look at YouTube. I'm sure you get hours of great content. But Dr. Aamer, I really want to thank you again for coming on. Appreciate your time. Back to the lab for the day, no doubt. But thank you so much.
It's been my pleasure. It's been some really interesting questions that have come through, and I've really enjoyed talking about the topic, and I hope that it's beneficial to the listeners as well.
I'm sure it will, definitely. Dr. Sandoo, thank you very much, and I'll speak to you soon.
Yeah, take care, Sean. Thank you.
Thanks, buddy.